My name is Sarah Bonzo. I am an assistant professor in the School of Business here at SUNY Oswego. And I'm also the program coordinator for our MBA in Health Services Administration program. I've been here since 2013. Prior to coming here to SUNY Oswego, I was working at Rochester General Hospital. And there I was doing process improvement work. In my last role there, I was the director of the Transformation Management Office. And my role there was kind of a project management office, and we worked on implementing and optimizing the electronic medical record. And so kind of after we had implemented and optimized, I saw the posting that they were looking for somebody to head up this new MBA HSA program, and I've been here ever since. So I really have two different research areas. One is more focused on kind of big data analytics. I'm interested in looking at Department of Health, the Sparks data here in New York State, and looking at how kind of trends in the population and in service delivery impact population health. I'm also interested kind of in that big data field and how we're using data from the electronic medical record. So we've got more data now than we've ever had before. How can we use that to analyze how we're delivering care kind of within the hospital system? And then the second aspect of my research is more lean methodologies and process improvement. So I'm really interested in the specific routines and habits that clinicians and kind of clinical teams use, and how making small tweaks in some of those habits can have widespread impacts on patient safety and patient throughput. Love SUNY Oswego. I absolutely love my job. And I love SUNY Oswego for a number of reasons. In terms of being a faculty member here, it's a very warm and collegial environment. I really like the other faculty members in administration have been very good about giving you kind of free rein to work on what you want to work on and teach your classes in the way you want to teach them. But what's really great is that there is a focus on teaching. So a lot of big institutions are very focused on research and bringing in a lot of grant money. And while we do have some focus on research, that's not our main objective here. It's teaching students, it's making sure that they are marketable and they come out very competitive when they're ready to look for a job. And I really like that focus. In terms of what I teach, so I teach operations management at the undergraduate level, and then in our MBA HSA program I teach health systems and managerial epidemiology. All of those courses are really fun to teach because it draws on my industrial engineering background and really has a strong operations and process improvement and predictive analytics flavor. But the experience for me as a faculty member is very different between undergrad and grad. So the undergraduate class is in the classroom face-to-face, pretty traditional. And it's really fun because you get students that come in that know absolutely nothing about the course, and they're really not that excited about it, and they're very forthcoming at the beginning of the semester, like, I don't really know much about this course, but whatever. And by the end of the course, I get students that say, I'm really actually interested in this field, and students who are finance and accounting majors say, I could actually see how I would use some of these tools and techniques in my job, even though I might not be an operations manager. I love that. I love that feeling. And then at the graduate level, it's very different because the courses are online and our students are spread all across New York. And in our program, about 85% of the students are working professionals. So we've got physicians and pharmacists and administrators in our program. And we honestly have students from almost every aspect of the healthcare industry in our graduate program. And so in the online environment, they all, in these discussion posts, bring in all of that experience into these discussions, and it's really neat to see one another ask questions and kind of learn from their peers, which you don't see in the undergraduate kind of traditional classroom setting. So it's really fun to be a part of. And in the graduate program too, I really like seeing people who come in with kind of clinical backgrounds, and when we start focusing on some of the more quantitative tools and techniques, starting to think about, okay, I can do this analysis with some of the data that I have in my system, and how can I do this analysis to figure out how we can get better? Oh man, so I am a real live person, and I have two small boys that have a lot of energy. So when I am not teaching or doing research, and I still do quite a bit of consulting, so when I'm not doing that stuff, I am spending time with my family. I'm picking up dinosaurs and footballs and trucks that are typically strewn about the house, and just spending time with them. We like to play sports. I played volleyball in college and I still play. And we ski, and my husband and I have a hops farm. So that keeps us pretty busy in the summer. So we just try to stay active, and yeah, that's me.